In this portion of the video series, we will discuss the heart. We will start with a general overview of the heart as well as a discussion of its great vessels. We will then talk about the vasculature of the heart itself, and we will finish with a discussion about the internal features of the heart. Here is a heart. We see the base here, the heart's apex here. This is its anterior surface, its right border, its left border, and lastly, its posterior surface. Looking at the heart's base, we see most medially the superior vena cava, followed by the aorta, and lastly, the pulmonary trunk is most lateral. Posterior to these great vessels, we see the four pulmonary veins here. Venous blood returns to the heart via the superior vena cava as well as the inferior vena cava and drains into the right atrium. The right atrium is the chamber of the heart that is most medial. Blood then flows into the right ventricle. This chamber of the heart is most anterior. The deoxygenated blood is then propelled through the pulmonary trunk and heads toward the lungs in order to be oxygenated. Upon returning from the lungs, the blood enters the four pulmonary veins seen here. The blood then enters the left atrium, which is seen here. The left atrium is the chamber of the heart that is most posterior. This makes sense because, as previously noted, these four pulmonary veins are the great vessels that are most posterior. Blood then enters the left ventricle and leaves the heart via the aorta to perfuse the body. Let's now talk about the vasculature of the heart. Okay, let's discuss the vasculature of the heart itself. The heart is perfused by two arteries, both of which branch off of the aorta. We have here the right coronary artery stemming from the aorta, and we see here the left coronary artery also branching off of the aorta. Returning to the right coronary artery, we can follow it as it loops around to the posterior surface of the heart and gives off the posterior descending artery. The fact that the PDA comes off the right coronary artery makes this heart right dominant. Returning to the anterior surface of the heart, we again see the left coronary artery here. The left coronary artery divides into the left circumflex artery and the left anterior descending artery. This is a branch of the left anterior descending artery known as the diagonal branch. The left circumflex artery can be followed as it courses laterally toward the posterior surface of the heart. As previously noted, we have the PDA here coming off of the right coronary artery. However, if the PDA were to have arisen from the left circumflex artery, this heart would then be left dominant. Lastly, if the PDA were to have branched off of both the right coronary artery and the left circumflex artery, the heart would then be codominant. Let's now discuss the veins of the heart. We see here the coronary sinus. All the major veins of the heart drain into the coronary sinus, which then empties its blood into the right atrium seen here. I'll insert my probe into the coronary sinus from the right atrium. On the posterior surface of the heart here, we see the middle cardiac vein. The middle cardiac vein is identifiable because it runs alongside the posterior descending artery. The middle cardiac vein empties its blood into the coronary sinus. Not visualized on our heart, but what usually is here is the small cardiac vein. The small cardiac vein is identifiable because it runs alongside the right coronary artery. The small cardiac vein drains into the coronary sinus as well. Returning to the anterior surface of the heart, we see the great cardiac vein here. Although in this heart, the great cardiac vein runs alongside the diagonal branch of the left anterior descending artery, usually the great cardiac vein can be identified because it runs alongside the left anterior descending artery itself. We can follow the great cardiac vein as it courses laterally and ultimately posteriorly to deliver its venous blood to the coronary sinus. As previously mentioned, the coronary sinus then empties into the right atrium because all this venous blood needs to head toward the lungs in order to be oxygenated. That completes our discussion of the vasculature of the heart itself. Let's now take a look at the internal features of the heart. Okay, let's discuss the internal features of the heart. We have the heart here in anatomical position. This is the anterior surface of the heart. I will flip the heart over and we will see the posterior surface of the heart. The superior vena cava runs in this direction and the inferior vena cava runs in this direction. These two vessels empty their venous blood into the right atrium. I will now open the heart and we will see the right atrium here. The superior vena cava meets the right atrium approximately here. At this point, one can find the sinoatrial node, seen here. Inferior to the SA node, we see the fossa ovalis here. Inferior to the fossa ovalis, but still within the right atrium, we see the opening and valve of the coronary sinus here. I'll insert my probe into this opening, and we will see the coronary sinus here on the posterior aspect of the heart. Returning to the right atrium, we see the pectinate muscles here. We also are able to visualize the crista terminalis here. This is a muscular ridge that separates the pectinate muscles from the smoother part of the right atrium seen here. We'll now follow the flow of blood from the right atrium past the tricuspid valve and into the right ventricle here. Inside the right ventricle, we have trabeculae carneae seen here. This is a papillary muscle. Attached to the papillary muscle, we have chordae tendineae here. This is a cusp of the tricuspid valve. This happens to be the anterior cusp of the tricuspid valve. Over here, we see another papillary muscle and its chordae tendineae attached to the septal cusp of the tricuspid valve. Here, we see another papillary muscle and its chordae tendineae attached to the final cusp of the tricuspid valve, which is its posterior cusp. I will now rotate the heart to its anatomical position seen here, and we will continue to follow the flow of blood from the right ventricle upward toward the pulmonary trunk seen here. This is the pulmonic valve. Just inferior to the pulmonic valve, we have the infundibulum seen here. Our incision went through the anterior cusp of the pulmonic valve. However, you can still visualize the left and the right cusps of the pulmonic valve. Blood flows past the valve, through the pulmonary trunk, and out through these pulmonary arteries here. We have the left pulmonary artery as well as the right pulmonary artery here. The blood goes to the lungs to be oxygenated, and it returns to the heart via the pulmonary vein seen here on the posterior aspect. We have 1, 2, 3, 4 pulmonary veins. The pulmonary veins empty the oxygenated blood into the left atrium, seen here. Inside the left atrium, we see this opening. This is the opening to the left auricle. I will insert my probe and we will see the left auricle here. Blood then flows past the mitral valve and into the left ventricle here. Inside the left ventricle, we see a papillary muscle here and its chordae tendineae attached to a cusp of the mitral valve. This is its anterior cusp. Here we see a papillary muscle and its chordae tendineae attached to this cusp of the mitral valve. This is its posterior cusp. Unlike all the other valves of the heart, the mitral valve only has 2 cusps. Here we see trabeculae carneae of the left ventricle. Also note the thickness of this ventricular wall. The left ventricle has a much thicker wall than does the right ventricle. Blood flows out of the left ventricle superiorly through the aortic valve and out into the aorta, seen here. Our incision went through the right cusp of the aorta here. However, you can still visualize the left cusp as well as the posterior cusp of the aorta. Blood then flows out of the aorta to perfuse the vital organs as well as the other tissues. That concludes our discussion of the heart. Let's now move on to our final video, which concerns the posterior mediastinum.